Hello, this is Dr. Gayatri, BHMS and REBT counselor. REBT is Rational Emotive Behavioral Therapy. As I'm saying so because most of the students, most of the people don't know full form of REBT. So here is the full form. And welcome to the Constitutional Drug Series. This is the drug series where I am giving you crux of the constitutional remedies like Pulsatilla, Thuja, Natramur and so on. From my personal readings, that is, I have read Philip Bailey, Boric, Allen, Kent and the stalwart books, whatever I have read. So I am giving you the crux of the main constitutional drugs. So let's start. And one more disclaimer: the patients, those who are watching this video, please don't take it on your own. If you are thinking so, please go and visit your doctor before trying it at home, any of the remedy, because this is solely for student purpose. This is an educational video. So let's start. Pulsatilla. I'm going to use English, Hindi mostly, also Marathi language, so that audience will not get bored. And let's go. Firstly, I'm going to discuss the बोरिक फर्स्ट पैराग्राफ पार्ट, जो कि बहुत इम्पॉर्टेंट होता है स्टूडेंट्स के लिए, क्लिनिकल प्रैक्टिस के लिए भी. एंड दिस इज़ द फेवरेट ड्रग फॉर द स्टूडेंट्स टू स्टडी. सो यहाँ पे लिखा है वीपी, थर्स्टलेस, बेटर बाय ओपन एयर, mucous membranes are all affected, discharges are thick, bland, yellowish green. So wherever you see the discharges, they are thick, bland, yellowish green. From nose, from cuff, if the discharges are thick, yellow, greenish, you can give Pulsatilla directly. Also, it can be indicated after abuse of iron tonics. For example, if the patient is suffering from diarrhea or patient is suffering from nausea, vomiting, by taking iron supplements, then you can give Pulsatilla. And it is predominantly a female remedy, but it can be given to a male person as well. फॉर एग्ज़ाम्पल, अगर आपको कोई बंदा दिखता है कि बहुत सेंसिटिव है, बीपी है, थर्स्टलेस है, लाइक फीमेल थोड़ा से कैरेक्टर्स है उसमें, so you can think of Pulsatilla also, because it is written that it is predominantly a female remedy, but it can be given to a male person also. Then after badly managed measles, symptoms are ever changing. No two symptoms are alike of Pulsatilla. कोई भी symptoms same नहीं रहेगा. It is changeable. It is the tendency of Pulsatilla. We can say changeability. It is the keynote. Thirstless, I have already said. Peevish and chilly. Thermally, Pulsatilla patient is chilly, but it is better by open air. Then when first serious impairment of health is referred to the age of puberty. Not well since puberty, Allen says. Great sensitiveness, wants the head high, feels uncomfortable with only one pillow, lies with hands above the head. Sleep position of Pulsatilla is she sleeps with hands above head. जो स्लीप की पोजीशन होती है वो है हाथ सर पे रखने की आदत होती है यूजुअली. सो Pulsatilla sleeps in that position. Also, I am going to compare this drug with the readings of Philip Bailey and Nash. In short, not going through whole page and page, so you will get the idea. Whatever I am talking is through observational experience, readings through Boric, Allen, Kent, Philip Bailey, Nash, and also Clark, some of the things. सो पहली बात तो फिज़िकल अपीयरेंस कैसा होगा पल्सिटिला का. फैट डिस्ट्रीब्यूशन यूजुअली हिप्स एंड थाइज में रहता है एंड शी इज़ वेरी माइल्ड, काम, जेंटल पर्सनालिटी, यील्डिंग डिस्पोजिशन रहता है. जैसे कि अगर आप उसको कुछ बोलो कि ये ऐसा ऐसा है तो वो जल्दी ही मान जाएगी. हाँ, आई अग्री, ओके, ऐसे यील्डिंग डिस्पोजिशन, हाँ को हाँ बोलना. उसका खुद का मोस्टली कोई ओपिनियन रहता नहीं है. शी इज़ इनडिसिसिव ऑल्सो, difficult to take the decision on her own. She is dependable on someone. Like here you can say irresolute or indecisive, we can say. Also she likes sympathy. She is ameliorated by consolation, or she desires for sympathy. She is timid, that is shy. Also morbid dread of opposite sex, given to extremes of pleasure and pain. She is highly emotional. As I said, she is very much emotional. संस्कारी बहू जो हम बोलते हैं, हाँ को हाँ बोलने वाली, उसके आज्ञाकारी बहू, this kind of females, they are usually pulsatilla. Mild, gentle, so that kind of constitution is pulsatilla. And contradictory tendencies also we can see in pulsatilla. Better always by open air. Physical appearance, once again I will say that she is medium built, obese, fat distribution in the hips, near the area of hips and stomach, and she is physically thermally chilly. And if you read belly, then you will get this. Pulsatilla has a characteristic appearance in the majority of cases, at least in Caucasians. The hairs are usually blonde, eyes blue-green, lashes naturally curved outward, face tends to be rounded, and skin is pale with blonde down on it like calcarea. Figure is generally full with rounded hips, well-developed breasts resembling that of Aphrodite, the goddess of love. The lips tend to be full, well curved like Cupid's bow, reflecting both sensuality and sensitivity. So this paragraph of Boric is very important for clinical practice and for students from 1st to 4th year. This paragraph is very much important. If you read this and then you can write like nose, throat, whatever given in Boric. Yellow brand discharges are there, thick, profuse, so everything is same. वहाँ पे आप फिर थोड़ा अपने हिसाब से ऐड कर सकते हो जो भी आपको लिखना है एग्ज़ाम में, क्योंकि ये फर्स्ट पैराग्राफ ही अब अगर आपको मालूम रहेगा तो आप फिर सिस्टम वाइज लिख सकते हो कि उसमें क्या क्या है, वो भी हम देखने वाले हैं आगे. सो अभी तक के मेन की नोट्स हैं: माइल्ड, जेंटल, थर्स्टलेस, बेटर बाय ओपन एयर, फिजिकली medium built, obese, fat distribution to the hips and near the stomach, sensitive, consolation, amelioration, as she desires sympathy. Now we will go to one by one, in short, not in detail. Head, wandering stitches about head. See, better by open air. As we have seen here, she is better by open air. So headache will be better by open air. Whatever nasal symptoms, they must be better by open air. Eye symptoms, they will be better by open air. So it goes on like that. Frontal and supraorbital pains commencing in the right temporal region with scalding lacrimation of affected side. Headache from overwork. Pressure on the vertex. In head symptoms, like in headache symptoms, or in all the complaints, Pulsatilla patient is usually thirstless. So you can take it as a concomitant. Patient will be thirstless and patient will be better by open air. Then ears and eyes discharges are thick, profuse, yellowish, bland. Lids are agglutinated. It can be given for styes, it can be given for otorrhea. Then mouth is dry, without thirst, thirstless. Crack in the middle of the lower lip. Yellow or white tongue. Usually white coated tongue is observed. Then it is a very good remedy for stomach complaints. She has averse to fat food, warm food, and Pulsatilla patient usually gets stomach upset or stomach complaints by eating bread, eating pastries, or such fatty food. Aggravation is seen. Irritation tastes of food remain a long time after ices, fruits, pastry, bitter taste, diminished taste of all food, pain as from subcutaneous ulceration, flatulence, etc. Weight as from a stone. There is sensation of a weight like nux vomica. Abdomen is painful, distended. There is loud rumbling. Colic. In these complaints also, Pulsatilla patient will be thirstless. Nausea, vomiting if in case present. Yellowish, thick, profuse discharges will be there. Stool. It can be given for hemorrhoids with itching and sticking pains. Mucus with blood and chilliness. Increased desire for urination. Worse when lying down. This is very much important. If in case you will get the patient of renal calculi or UTI or such kind of pathology, then there is ineffectual increase in desire, which is worse when lying on back. Burning is present. Involuntary micturition at night. And female complaints, yes, it is again a predominant remedy for female complaints such as dysmenorrhea, amenorrhea, also given for infertility cases. Let's go with this. Suppressed menses from getting feet wet. This is a good keynote. You can get 2 marks question on this. Menses are changeable. As I said earlier, no two symptoms are same. There is changeability. For example, if right side knee pain is there, it will go and shift into left side, like alternating or changeability. If pain is there in the upper limbs, it will go next to the lower limbs. There no two symptoms are no two symptoms are same. There is changeability. No two stools are alike if she is suffering from diarrhea. Intermittent chilliness, nausea, downward pressure, painful flow. Intermits, leukorrhea is acrid burning, and there is pain in back. One more thing, diarrhea during and after menses. There are a lot more other remedies also which has this symptom, diarrhea during or before menses or after menses, but Pulsatilla, it is during and after menses. Male complaints, orchitis, pain from abdomen to testicles. Then it can be given for acute prostatitis, pain and tenesmus, again worse lying on back. It is same as this. Respiratory complaints, yes, it is a good remedy for respiratory complaints. Dry cough is there with expectoration, yellowish discharges, thick, profuse. It can be given to child also, where child is shy, thirstless. There is loose cough in the morning with mucus expectoration. Thirstless. Thirstless accompanies every complaint. Now we'll go to sleep. Unrefreshed, irresistible sleepiness in afternoon. Yeah, this is one more important symptom which you can confirm for finding out the constitution. Pulsatilla patient is sleepy after meals because it needs energy to digest the meals, so she feels sleepy in the afternoon post lunch. So as she is obese, or we can say she is little bit fat, so it needs energy for her to digest her own meal, so she feels drowsy, sleepy. That's why there is sleepiness in afternoon. And first we have discussed this symptom, sleeps with hands over head. Then skin complaint is important, urticaria after rich food, that is pastries, with diarrhea from delayed menses, fever, chilliness even in warm room, without thirst, chilly with pains in spots, worse evening, chills about 4 pm. Modalities, one more symptom is important is this, boring pain in heels towards evening, suffering worse from letting affected limb hang down. Why? You can see this symptom in mostly varicose veins, or osteoarthritis or rheumatoid arthritis. There is pain in the limbs which is worse from letting the affected limb hang down. Veins in forearms. And main modalities of drugs are worse from heat, rich fat food, after eating towards evening, lying on back or lying on left or on painless side, and when allowing feet to hang down, better usually in open air by cold applications and cold food. So now how will you differentiate it from natremure or say lacasis? Natremure has its own thoughts, opinions, she can take decision on her own, she is independent. Sapia is also independent, but Pulsatilla has yielding disposition, she is shy, she is indecisive, can't take decision on her own, she is dependable. Pulsatilla and lacasis are usually, it is very little bit difficult, you have to go through follow-ups and all, as both are loquacious, both have medium obese build. But the thing difference is that there is a, a more suspiciousness which is seen, and trust issues which are seen in lacasis personality, and lacasis personality has violent anger as compared to Pulsatilla. Pulsatilla also may get angry, but lacasis anger is more than Pulsatilla. Pulsatilla is quiet and mild and gentle and less suspicious. We can say uh, very less suspicious as compared to lacasis. Pulsatilla बहुत easily trust कर लेती है, whereas lacasis will not. And I will, in short, will revise and go through NASH. Mild yielding disposition, despondent, weeps easily, sandy blue eyes, it is physical constitution, changeable remedy, pains travel from one joint to another, hemorrhages flow, stop and flow again. So as we have discussed that it is changeable, no two stools are alike, no two chills are alike, aggravated in morning, stomach easily disturbed, thick bland discharges, modalities aggravated warm room, ameliorated open air. So आप देख पा रहे हो कि जहाँ पे भी आप देख रहे हो ameliorated by open air, changeable remedy, thirstlessness, so आपको वो कॉमन सिम्टम्स देखने हैं जो कि आप क्लिनिकल प्रैक्टिस में यूज़ कर सकते हो. Pains accompanied with constant chilliness, frequent micturition like thuja. With delirium, it is given Veratrum album. The disposition is almost opposite of that of Nux vomica. Nux vomica is called man's remedy, and Pulsatilla is woman's remedy. Mild, gentle disposition, cries at everything, VP sensitive. It is wide range of action. Then there is submissiveness. Silent grief is there. Changeableness of the symptoms. It can be also seen in ignatia. Mostly we use ignatia. All that hearing said, wandering pains shifts rapidly from one part to another. Patient is irritable, then tearful again, mild, pleasant. Irritability is also a most marked symptom in Pulsatilla. Okay, then there is no head and tail. There is bad taste in mouth, especially in early morning. Pulsatilla is drowsy after meals. There is dryness of mouth, that's why there is thirstlessness. Stomach disorder from cakes, pastry, rich food, etc. Thick, bland, yellowish green discharges. Painful menstruation. Aggravates from warm room. Heat of bed aggravates. It is as similar to mercurius as heat of bed aggravation is a tough modality in mercurius also. Affections consequent on the abuse of iron, as we have seen it in boric in the first paragraph. So here Nash also mentions affections of consequent on the abuse of iron. Chronic affections following cases of badly managed measles, that is also written in boric. So see what important symptoms were there in boric, Nash also mentions in his book. Pressure or tying up tightly relieves the headache. Yeah, it is also similar to argentum nitrica. Increased inclination to micturate aggravated when lying. This is again a keynote symptom. So a short note of Emil Tyler says in 5 to 6 words for Pulsatilla patient to find out is mild, gentle, VP, consolation, amelioration, thirstless, chilly, worse by heat, better in open air. If you are talking about children, then cry baby, needs support during sickness, desire for mother's lap or constantly clinging to mother. She is irritable, she is thirstless again. Yes, so almost I have covered all the points. If you have any doubt, if you want to discuss, do comment and we will discuss. Compare it with Lacasis, Natramur and other drugs. Do read Boric, Philip Bailey, Nash, Kent for detailed information. I have given crux, I have tried to given the crux of the Pulsatilla. So yeah, let's go for the next drug tomorrow. And this is Pulsatilla. Thirstless, VP, sensitive, mild disposition, timid, bad effects after iron tonics, urination, ineffectual desire, aggravated lying down. Then comes better by open air, sleeps on hand on head, sleeps head, headache, usually better by tight clothing like argentum nitricum, and post meals she is drowsy and chilly patient. Physical appearance, medium build, can be also given for thin build, but most predominantly medium build, fat distribution towards hip and abdomen area. Yeah, thanks.